Hi, I'm Hema Downard from the Data Science Team 4, and today I'm gonna talk about our project, which is our goal was to use the data visualization to convey our message, which was how we can prevent or detect diabetes early. We use a diabetes data set, and And our population, yeah, we use Ontario as our target population. And in Ontario, we have 16.3 million people, and people like who are over 40 is 7.8 million. And we have about 2 million who have diabetes, and the annual health cost is about 1.5 to 2 billion. And high-risk people who are above 40, who are high risk for diabetes, our model has predicted like 34%, which is 2.65 million. As you can see, this is a huge, this is huge, and it's going to have a big impact on the healthcare system. And so our goal is to how we can reduce the diabetes cases by at least 10%. And by using preventing measures, and which is educating people on the early symptom and how they can get a check early, and also reduce it by adopting good healthy habits. And so the process we use is as follows. Uh, we use, first of all, we use data analysis. And we did the data cleaning and preparation. Uh, we use scope analysis, whereby we look at the data. We said if there's any correlation between the features. Again, the data set had 16 features as shown in the graph here. It has 16 features. Sorry, just maybe move it. Yeah, yeah. So 16 features. Polydipsia, which is frequent urination, polyuria, which is frequent thirst, as a gender also has an effect, irritability, genital thrust, and partial parenthesis. So all these we had 16 features that we had to use. So we did the exploratory analysis and see which graph will make more sense, based on the symptoms and so on. And yeah, and then we use model-based visualization. We use random forest and logistic regression based on the data set to predict like if that person is a high risk for diabetes. And so far, it looks like random forest was better when we did the evaluation. The log loss was just 0.068 compared to logistic regression was a log loss was 0.15. And after that, then we decided how we're gonna communicate it to the public and the healthcare professional, what is the best way. Again, I just wanted to say, yeah, from our analysis and so on, we found age is another important factor, as you grow older, like after 40, the risk increases drastically. So it's good to start regular screening after 40 years old, and then also it keep rising after 50. So after 50, I think you should be doing a yearly screen. And so again, the modeling shows diabetes risk tend to increase with age 40 plus are a meaningful screening group, and age 50 plus appear to fall into a higher risk zone in the visual framing. And so throughout the process, I learned and lastly, yeah, for the communication, we use a flyer. So this is our flyer that shows us, yeah, or what are the early sign? Like again, like I mentioned earlier from the graph also, it shows like excess polydyspia, excessive thirst, and frequent urination are the top two symptoms. And we have some others, delayed healing, obesity, and so on also are quite important. And yeah, so this basically is a call to action to um, get checked. And these are the graph we use. So we thought these are simple and easy to understand graphs. So yeah, what do I learn for the process? I learned that it's very important to have a large data set where male, female are equally represented. And I learned how to develop reproducible model and how to evaluate them and using different metrics like log loss, RAC, AUC. And also how to use data insight into appealing visuals like shown below in the flyer. Like it should be, appealing, get what the person want to read and easy to understand. And what challenges did we encounter? Yeah, so first of all, is that data set was very small. We had just 520 records and 16 feature. And and it was very imbalanced too. We had 30%, which are about 129, 92 were female and 63% were male. And also most of the female had diabetes. So yeah, so that one was I would say was our biggest challenge, the data set. Secondly, I would say we didn't have enough time. We just had 2 weeks, and also we were like a meeting 3 to 4 times, and that was for 2.5 hours. So that was, like we wish we had more time to do yeah, more time to analyze and more time to work on it. But I think overall, like with the time, I think we did a great work. The team did a great work, and how did we overcome the challenges? Like, yeah, so we did the best again. Whatever we had, we did the best we can with the data we had. Mm, and we try to find using models we try to use model like I mentioned, logistic regression and random forest to do the prediction for us, to scale and do the prediction. And and hopefully, we are hoping if we get better data set, then we can still use a model we've developed and evaluated, but then we can get a better result, I would say. And future work. Future work, I was thinking we can, again, like I said, a bigger data set with more features, features like ethnicity, family history, income, which I think will have a important role. They might be an important indicator that the person might develop diabetes. And secondly, which we have started but not completed, is like a QR code in the flyer, linking it to a UI, diabetes risk screening tool that we are thinking. So add a QR code to this flyer, and also which will link it to a diabetes risk screening tool where you enter your age or gender and any symptom you have, and it should show you your high probability for diabetes or low, moderate, and then maybe tell you a plan, what you should do. And thirdly, maybe translate the flyer. Since Ontario is bilingual, so translate the flyer into French. What strengths did I bring to the team? So I think I'm good at seeing the big picture. So when we got the project, I was able to visualize a big picture and the whole workflow from discovery, data analysis and preparation to model validation, development and validation, and to launch. And also, I'm good at keeping the team on track and focus. And this I was doing it using a GitHub project, assigning a task to the team and the due date. And also, the daily stand-up also really help to check what each team members is working on and any roadblocks they encountered. And we did our best I did my best to remove those roadblocks. Thank you very much.